If you suffer from a mental health disorder or you love someone who suffers from a mental health disorder, then this video may be one of the most important videos you watch this year. I have the great honor of having my friend, Dr. Chris Palmer, a psychiatrist who recently released his new book called Brain Energy. And we are going to be answering your questions for the next hour or so about mental health and about how you can fix your diet to help improve your mental health symptoms, and in many cases, reverse the symptoms completely. Now, if you know someone who suffers from mental illness, please right now click the share button below this video and send it to them in a text, an email, a direct message, or you're welcome to share this on your favorite social media. Millions of people around the world are suffering from the exploding mental health epidemic that seemingly has no cause. That psychologists and psychiatrists say, we don't really know what's causing this, but our only solution is to, here, take this pill or these two or these three or this handful of pills. Come to therapy all the time and take all these pills. And that's basically the best we have to offer you. So we're going to be taking lots of questions. Go ahead and start typing your questions in the comments so I can have a lineup of questions. And then also, if you have used a proper human diet, anywhere on the spectrum of a proper human diet, from low carb to keto to ketovore to carnivore, if you've used your diet and changed your diet to fix your mental health, please share your story in the comments. Dr. Chris Palmer, author of Brain Energy, is going to be joining me in just a minute or two. I'm still waiting for him to join. Let me make sure I haven't missed something here. He had an important call he had to take, and as soon as that's finished, he's going to join me here. So we've got time for you to be sharing this out everywhere, getting as many people who need this information. You need to get this in front of their eyes. You need to get this message to their ears, and you do that by sharing this video. So many people have reached out to me and say, hey, I thought what you talk about is just a waste, just silly foolishness, not true. But then I started reading the comments in your video about the stories from people who said, hey, I used to have severe anxiety, severe depression, severe OCD, even personality disorder, schizophrenia. And once I started to implement the basic principles of a proper human diet that you talk about on this channel, my mental health got better, noticeably better. My friends and family members noticed the difference. My mental health care provider noticed the difference. I can't believe what a difference it made. So please don't discount diet, what you eat and what you refuse to eat. These things can make huge, huge differences in your mental health. Lacey says, my mental health was cured with keto. And many of you guys watching this, whether live or on the replay, you may think, well, keto's a fad diet. There's no way that could help my mental health. You've been misled about what a ketogenic diet is. A ketogenic diet is effectively eating meat and eggs and some veg, a few berries, a few nuts. That is literally the diet that human beings have been eating, that our ancestors have been eating for millions of years. So to call that a fad diet, if your healthcare provider, your mental health care provider said, oh, keto's a fad, it's dangerous, you don't want to do that, you need to maybe share this video with them. Maybe share a copy of Dr. Chris Palmer's Brain Energy with them, because they don't currently know what they're talking about. Let me see what kind of stories we got in the comments. Here we go. Oh, yeah, the comments are coming in now. Natalie Stone says, my brain fog is gone. My forgetfulness is gone. Jen says, I had horrible anxiety that affected my daily life to where I couldn't leave the house and was constantly stressed out. I'm so much better. I mean, so much. I'm cured. Baddest Cat just ordered Brain Energy. Absolutely. If you suffer from mental health, you need a copy of this book, Brain Energy. I got a link down in the show notes. If you have a friend or someone you love and care about who has mental health issues, please get them a copy of this book. There's also an Audible. There's a link in the show notes. If you know a mental health care provider who currently says stupid things like, oh, diet doesn't matter for mental health, you can eat whatever, eat all things in moderation, eat the rainbow, it doesn't matter what you eat for your mental health, just take these pills, they need a copy of this book. That's my opinion. What do you think about that? B. Rose has been keto, ketovore, and sometimes carnivore and has lost over 100 pounds. Wonder what that does to your mental health when you lose 100 pounds. I wonder. Trish says, how does someone eating a SAD diet transition to a proper human diet for improving bipolar disorder? And this is one of the disorders that we've gotten hundreds of people feedback, comments, emails saying, oh, my bipolar disorder is so much better. I was able to either decrease or stop my bipolar medication with the help of my doctor. So the step one is to eliminate all sugar from your diet, definitely added sugar, but also much of the naturally occurring sugar that occurs in breads, even whole grain bread, that occurs in fruits, definitely that occurs in fruit juices. Number two, get rid of all grains out of your diet, wheat, rice, oats, corn. And then number three, get rid of all the vegetable seed oils, the plant butter, the margarine, all that stuff is not feeding your brain the nutrition that real animal fats have in them. Shane Jones says it helps alcoholics quit drinking. And I think Chris Palmer is going to talk about that when he joins me. Many people notice that addiction to nicotine, addiction to alcohol, addiction to other drugs, even addiction to prescription drugs, the withdrawal process is much less painful when you're eating a very low carbohydrate, nutrient dense, satiating, proper human diet. Lacey says, I took Wellbutrin and Lexapro. I'm not anymore. It was all about the foods that I was consuming. Yep, Lacey's figured it out. And now Lacey's teaching all her friends about this. Carney Cave Girl says, carnivore has not only put my autoimmune condition in remission, but I have no more anxiety or depression. I hear this all the time. Lisa says, I have PTSD, another condition that really responds to a proper human diet. She has PTSD, anxiety, and depression. I definitely feel better when I'm keto. We're still waiting for Dr. Chris Palmer to join us. He's on an important phone call. As soon as he's done, he's going to jump on here and he's going to be taking your questions. Eat to Fat says, was struggling at work, brain fog and forgetfulness, corrected in a couple of months. James has reduced his Zoloft dosage since being on keto. Lisa says, I credit being able to quit 25 years of benzodiazepine use for anxiety, panic. She credits intermittent fasting and keto for this. So if you're taking a benzodiazepine like Xanax, Klonopin, Valium, or any of the others, you're addicted to that. If you've been taking that more than a few months, you're addicted to that. And you need to wean down and come off that with the help of your doctor. And a proper human diet is going to make it much less difficult and painful. Eileen says, carnivore or ketovore for the past 15 months, lost 86 pounds and reduced my meds. Bye-bye, Zoloft. 51-year-old woman who's menopausal. So if you're taking one of the SSRIs like Prozac, Zoloft, Paxil, Effexor for menopausal symptoms, you might want to take note of Eileen's comment. She is menopausal and she no longer needs the Zoloft. I find that fascinating, but it also makes perfect sense. Jake has asked multiple times, do any of you eat a small amount of carbs each day? Would you say under 100 or less than that? So the spectrum of a proper human diet is no human on the planet needs more than 100 total grams of carbohydrates a day. You don't need that much, but no, any human, no matter how young, how athletic, is going to suffer if they're eating more than 100 total grams of carbs a day. Most people do best if they're eating under 50 total grams of carbs a day. Don't count net carbs, count total carbs. Many people notice that they improve even more if they eat under 20 total grams of carbohydrates a day. And then some people like me have to turn down the carbohydrate intake as close to zero as possible on a carnivore diet to get the maximum physical health and mental health benefits of a proper human diet. Eloy says, diagnosed bipolar, started carnivore. I've never felt that I've been on a more even keel. My shrink does go silent when I talk about my diet and exercise regimen. And this is something that really confuses me. I have no idea why healthcare providers don't want to talk about diet, because the medications that they prescribe for mental health disorders have such a low success rate. Very, very often, either they just don't really help the patient much at all, or they have such disastrous side effects that the patient can't even take the medication. And so eating a proper human diet, which is side effect free after you get through the sugar withdrawal and the carbohydrate withdrawal, and then getting out in the sunlight, getting more movement in each day, these things don't have side effects. So why in the hell do healthcare and mental health care providers not want to talk about diet and exercise and getting sunlight on your face every morning? I'm mystified. I don't know why that is. Ashley says 8 weeks off Concerta by increasing fats and minerals, starting the mornings with coffee with tallow now instead of drugs. Loving the book Brain Energy so far. Excellent, excellent, excellent. All right. In hoc, not major, but on ketovore, my mood improved dramatically. Irritability and occasional depression gone. That's why my wife supports my diet. And this is many people are married to someone who they love very much, but who suffers from mental health disorder. And so you have to be very diplomatic and very loving in saying, hey, I've been hearing a lot of positive feedback about this certain way of eating actually helping mental health disorders in many cases better than the medication. I wonder if we should try this together as a team. That'd be a great way to say that. Sharing is caring. Michael says, I totally agree. Feel free to share this video with any of your friends or family members who suffer from a mental health disorder. Let me see if I've heard from Chris. He should be joining us at any time. Where are you at, Chris Palmer? I know he's doing something important. Linda says, how do I find a doctor that supports carnivore? So Linda, I have a YouTube video called How to Find a Low Carb Keto Doctor Near You. And in the show notes of that video, I've got 5 or 6 links to websites that are databases of doctors who are low carb and keto friendly. And any doctor who understands the keto diet is also going to understand a carnivore diet. So check out that video. Rose Red says, what about keto powder you can mix with drinks? So all of the keto powders on the market are a waste of your money. That is not a keto diet. A keto diet is eating lots of fatty meat and eggs with the yolk, some vegetables, a few nuts, and a few berries. That's what a keto diet is. It has nothing to do with drinking keto shakes or taking keto powders or taking exogenous ketones. That's just people trying to make money off you, Rose Red. That's what that is. So stop wasting your money on products and start investing your money in real, proper human diet food. That's where you're going to get the most bang for your buck. Semi-retired Bob does just best, very close to zero carb. He eats beef, water, and salt. And you may think, if you're just joining me and thinking, well, that sounds terrible. That sounds very restrictive. That must be miserable. So semi-retired Bob would tell you that the benefits of eating that diet, the pleasure and the joy that he now has in his life, far outweighs any restriction that you might think would come from a diet like that. Cat Claus has a seizure disorder, had 22 seizures in an 18-month period, doing a combo of keto carnivore, and I've only had 2 seizures in the past year. That's the kind of brain function improvement you can expect by eating a proper human diet. That's absolutely wonderful. Ida loves meat and eggs. Still waiting for Dr. Chris Palmer to join me. Getting along home said, I just finished Brain Energy, sharing with anybody I can get to listen. No depression, no anxiety since starting keto 5 years ago. Thank you so much, Dr. Palmer. So this is the book, Brain Energy, by Dr. Chris Palmer, MD. He's a Harvard-trained psychiatrist, and he is literally going to change how mental health is treated in modern society. So there's a link down in the show notes to that book. If you want to get started, you can download the Audible. There's a paperback and there's a hardcover that you can get started with. Olga says, how about children with autism? So Olga, there's a movie that you can find on the internet called The Magic Pill. And it's actually about a beautiful little autistic girl who they converted to a ketogenic diet. And just watching her transformation over the course of that documentary will bring a tear to your eye, because the parents realized we were basically poisoning our child, but we didn't know. No doctor told us that this stuff was actually making her autism worse. And so The Magic Pill is a great resource. And I'll try to remember to ask Dr. Palmer about autism. And so we're going to hear, I think I've got Dr. Palmer with me now. Let me get him in the stream. There's my friend, Chris Palmer. How's it going?
I'm not.
Uh-oh. I can see you, Doc. Can you hear me? I'll pull him back out. He's setting up his audio and video. So Chris Palmer's now joined us. He's going to be live with us in a minute, and he's going to be answering your questions about mental health. So please type your question in the comments. Nick says that I and Chris Palmer saved his life. And I hear this a lot, and I don't get a big ego or a big head when I hear this. I'm thankful when I hear this, because that's my job as a doctor, is to save people's lives. Let me see. Here we go. This is Ray. I'm low carb. My wife and kids choose to follow a nutritionist that pushed egg whites. Therefore, I eat all the yolks they leave along with my other eggs. Is this okay, or am I pushing it? No, it's totally fine, Ray. Very often, if I eat 10 eggs for a meal, I will discard 4 or 5 of the whites, but keep all the yolks there, and thereby increase my fat to protein ratio. I seem to do much better on a higher fat ratio. So no, I don't think you're doing anything wrong or doing any damage. So Solma says, carnivore saved my life. Yeah, anytime Neil and I hear somebody say, I just eat meat and salt and water, we both say, that sounds delicious. All right, let's see if we've got Dr. Palmer. Dr. Palmer, can you hear me?
I can hear you now. Can you hear me?
Yes, my friend. Welcome back. Welcome back.
I am so sorry for being late.
No worries. I know you were doing something important, and we've got you for what, the next hour?
Sure.
Oh, beautiful, beautiful. Okay. And so I have put out the call for everybody, if they have questions about mental health, to ask them in the comments. If you guys want to get your question bumped to the top, you can include it as a super chat. If you can't do that, that's totally fine. I'm looking through all the comments, but super chats get priority. Okay, Dr. Palmer, I want you to tell us a little about yourself and about this intriguing book that I'm holding right here, and why we should care what you think.
So my name's Chris Palmer. I am a psychiatrist. I've been a psychiatrist for 27 years at McLean Hospital and Harvard Medical School. My day job has been running continuing ed for this hospital. So I run lots of Harvard conferences. I have done 15 years of neuroscience research. And I will be honest, I have been frustrated as hell with the mental health profession. I kind of went into psychiatry because I was angry at the mental health profession because they just don't do what they're supposed to do. I saw firsthand in family members and my own struggles when I was younger, this shit ain't working. It just, sorry to use foul language already, but that was just the way I felt. These pills are not working. These psychiatrists, are they just incompetent? They all seem like snobs. I don't really like them anyway. They just hold their noses up at you and just,
Yeah, I remember back when I was practicing full time, I would send, I as a family medicine doctor, I would refill a lot of psychiatric meds that people would come to me on. I very seldom started them because I didn't feel like that was my wheelhouse, but I would routinely refill them. But then when I would have a new patient with obvious mental health issues, and I would refer them early in my career, I would refer them to psychiatry, right? Thinking it's kind of magical, right? They're gonna do some psychotherapy and they're gonna really dig down in there and pull out the gears and see what's wrong with this brain and fix this brain. And I would uniformly have people come back to me and say, what was that all about? I literally saw the doctor for 10 minutes and he wrote me a prescription for 3 medications, which I'm now taking, and I literally can barely get off the couch. And I'm like, that's psychiatry. That's what it is. And I was just, explain that to us. Why has psychiatry, we all think of Sigmund Freud and laying on the couch and just literally somebody digging into the guts of our mental brain and just rewiring things. Is that what really happens on the psychiatrist's couch these days? Or has that changed? And why has it changed?
It speaks to this fundamental issue, which is, there's this huge common sense question. What exactly causes mental illness? Like what causes people to have severe depression, or what causes schizophrenia, or what causes alcoholism even? For some of these things, everybody thinks they know. Well, alcoholism, those are just dirt bags who don't care about anybody. They don't have a moral compass. They just need to get some morality and some ethics and they'll be fine. And yet they can try year after year after year. And no matter how hard they try, they just can't seem to get better. And it turns out people with alcoholism often have more than one mental disorder. They've also get diagnosed with depression or bipolar or something else. And then everybody's like, oh, they're just a mess. But our field has not been able to answer that basic question. What exactly causes mental illness? Instead, we just know some of the factors that seem to play a role. Things like genetics, neurotransmitters, hormones, inflammation, but also all the psychological and social things, trauma, stress, adverse childhood experiences. All these things come together to cause mental illness, but nobody knows how it all works because the brain is really complicated and people are trying to figure it out. So we're kind of shooting in the dark in terms of what the hell are these mental disorders and what's causing them. And like they're real. Most mental health professionals know with certainty, I do, these things are real. These things are really destroying people's lives. People can be tortured by their symptoms. They're not making it up. They're not just whiny and complaining. And they are tormented by whatever's happening in their brain, and they can't control it. And it's not their fault. And yet we still don't know what causes it. All the treatments, the treatments for a long time focused on psychological things like Sigmund Freud and cognitive behavioral therapy, assuming, well, these are just thoughts in people's heads. we'll talk them out of these bad thoughts and that'll fix it. Well, for some people with some conditions, yeah, that can be helpful. And that's great. It helps some people with some of these conditions. But for the majority of people, that doesn't work. That doesn't solve it. And then our field went to, well, it's chemical imbalances, all these neurotransmitters in the brain. That's what controls the brain, is all these neurotransmitters. So let's give people pills to rebalance their neurotransmitters, and that should fix them up. Well, sounds good on paper, but
yeah. Well, let's talk about that for a second, because the big advertising push for SSRIs like Paxil, Prozac, Lexapro, Effexor, Zoloft was, we will fix your neurotransmitter deficiency or imbalance. And I still have people on my YouTube videos say, no, my doctor said that I've got a neurotransmitter imbalance. That my brain is broken. I have to take these medicines for the rest of my life. And you're a board certified psychiatrist, and you dig into the psychiatry research all the time. Has there ever been a shred of evidence that people with depression or anxiety or OCD or other mental health disorders, do they have a neurotransmitter deficiency or an imbalance? Has that been shown? Has that been proven?
No. And no. It's not for a lack of looking. They have. So the way that theory came about, let me just explain it to maybe help people understand, is, the first antidepressants were actually discovered through serendipity. The very first antidepressant was actually an anti-tuberculosis treatment. And the way they figured it out is that they were given this anti-tuberculosis treatment, basically like an antibiotic kind of treatment, to all these people with tuberculosis. But the ones who were severely depressed sometimes were just seeming a little happier. And so the doctors on the tuberculosis wards were like, wow, that's really weird, because these severely depressed patients who also happen to have tuberculosis are really perking up with this medicine. And that actually started us off on antidepressants. We didn't know how the hell it worked. We didn't know why it worked. We just knew it seemed to perk some people up. And so we started using it. So researchers started trying to look at, well, what the hell is this drug doing? What is it doing to the brain, and how can we understand it? At some point along the way, they came to the conclusion that this drug might be affecting serotonin somehow or another. So then they developed all these drugs to affect serotonin. And lo and behold, some of those drugs worked. Now, they assumed that it must be the serotonin in the brain. They didn't have any proof for that. And they didn't have any research studies even showing that it's the serotonin in the brain. Now, for those of you who don't know, 95% of the serotonin in the human body is actually in our gut. It's not in our brain.
Right. So what you're telling me is that none of the research that showed that SSRIs were effective and worked and how they work, because I can remember as an early doctor, the Zoloft rep would come and say, oh yeah, once you fix their serotonin, they're going to be better. And I just assume I'm just a dumb redneck family medicine doctor. I would just assume that they had done lumbar punctures, and they had sampled hundreds, if not thousands, of people, their cerebrospinal fluid, and had measured the serotonin and the norepinephrine and other neurotransmitters. I just assumed that they knew what the hell they were talking about, because they implicitly led me to believe that it was a serotonin imbalance or a serotonin deficiency, and this medicine would put plenty of serotonin back into the junction, and that would make them feel better. But none of that research was ever done, was it?
Well, no. The sad part is that research was done, and it never showed any serotonin deficiency.
Okay.
So they did do those lumbar punctures, and they did those brain scans, and they did autopsy studies. They did all of it. And at the end of the day, if you look at like the meta-analyses of all of those studies, oops, it does. The serotonin is fine in these depressed people. What the hell? And
yeah.
but they kept clinging to, but the medicine works. So we must just not be measuring the right thing, or maybe maybe we don't know, because the brain is complicated again. It's tiny little cells, trillions of cells. Maybe we're not measuring in the right place, in the right way. And so our theory still has to be right. It just has to be, because, why wouldn't it be? And, but they kept getting all this evidence that was telling them, no, you got to look somewhere else, or you got to think differently about why might that medicine work. Nobody thought to go to the gut. Nobody thought to, well, if all the serotonin's in the gut, does this have something to do with the gut? And nobody thought about that.
I got it. I talk says I'm severely depressed, major trauma and loss. So that brings me to this question. Do you feel like that depression as a diagnosis is overdiagnosed or too quickly diagnosed? Let's say someone loses a spouse, or loses a parent, or loses a dear pet. Are they too quickly diagnosed and too quickly prescribed antidepressant medication? Should we expect some degree of depression after a huge loss, or should we try to treat that pharmaceutically very soon after that loss?
So it's a really important question. And I make the distinction in the book, between, so every human being has been depressed at least for a few days. Every human being has been anxious at least some of the time for some reason. A bad test, or your boss or your teacher yells at you, or your parents yell at you, or something. People have emotional reactions. Those are not brain disorders. Those do not require pills necessarily. Those are normal reactions to adversity. I do think that there are people with mental disorders where the part of the brain that controls depression, for instance, is overactive and just not turning off. Or the part of their brain that controls anxiety starts firing for no good reason. So they have a panic attack just out of the blue. They're not doing anything stressful or life-threatening or anything. And then out of the blue, they're just having a panic attack for no good reason. I would say those people have brain disorders. Their brain is doing something it shouldn't be doing. But when people have trauma and loss and have symptoms, I think it is silly and lacks complete common sense to say that they have brain disorders. I just do. Now, that doesn't mean those people don't need help. Obviously, they need help. But that help is common sense help. It's compassion from other human beings. They need help. They need support. Maybe they need to talk to somebody. If they don't have enough people in their life who can help them and support them, maybe talking to a psychotherapist would be helpful. If you're going through a divorce and you don't know how to cope, yeah, maybe. And even in some cases, if you're really overwhelmed and you can't sleep, maybe short-term a sleeping pill could be useful. But let's be clear, it's not because this person has a brain disorder. It's because they're super stressed for clear, understandable reasons. And we can help them sleep with a sleeping pill. But we're not going to prescribe it forever and ever. This isn't a forever treatment. This is you're going through a rough patch. We'll help you sleep, try to get your sleep back on track. I think that is all fine, but I am a big fan of making the distinction between trauma and adversity and normal reactions versus a disorder. And the analogy that I give that a lot of people, it sometimes helps people get it, is pain. Every human being will have pain. If you go in for surgery and a surgeon cuts you open, you're going to have pain. Now, nobody diagnoses you with a disorder. They don't say, "Oh, you got a pain disorder now, Chris Palmer, because you're having pain all the time." Like, well, you're having pain all the time because that surgeon just cut me open. But that doesn't mean I have a pain disorder. It means I got normal pain. Now, it doesn't mean the doctor's not going to treat it. Yeah, the doctor should be treating my pain, and I might be taking some pills for it to decrease my suffering. That's okay. But nobody's saying you've got a lifelong disorder, Chris Palmer. But there are people who do have pain disorders and, who got chronic low back pain forever and ever, years on end. And that person does have a malfunctioning pain system. And we just need a different approach to thinking about those disorders and a different approach to treating those disorders.
Totally agree. Moog Moon says, can Dr. Palmer speak on how having the dirty gene, COMT and MTHFR, can affect someone who has them? And keep in mind, everyone, now's the time to type your mental health questions into the comments. If you want to bump your question to the top, you can include it in a super chat, but that is not necessary. What's your answer to Moog Moon?
So it turns out that we've done large studies of, COMT and MTHFR are commonly diagnosed in people with mental disorders, but in fact, they are super common. Like about 30% of the population, the entire world's population, will have the MTHFR kind of allele variant. And the majority of those people do not have a mental illness or a neurological disorder. So although those genes can play a role for some people in terms of some of the factors like methylfolate, can you methylate your folate so that it's useful? That can play a role. And if you have one of those genetic differences, sometimes it can be helpful to try something like methylfolate to see if it makes a big difference for you. But I will tell you, the research studies so far to date say it doesn't seem to be that big of a difference for the majority of people. In theory, it seems like maybe it would play a role, but it doesn't really seem to be playing a role in most people. And, I've had a lot of patients who've had that genetic testing. They've sometimes tried methylfolate, which sometimes can be really expensive. If you get it as like Deplin or something, it can be super expensive. And I have never actually, I can say in my 27-year career, I have never seen one patient where that was like the game changer for them.
I think in many cases, looking for COMT and MTHFR in someone with mental health is a lot like looking for your car keys under the street lamp, because that's where the light is. But like Dr. Palmer just said, if you check the general population, there's going to be millions of people with these defects that don't have any mental illness. So we cannot say that they are causative. They may be contributing to some degree, but they really can't be causative. Becca Price says, now, and I'm going to use this terminology. I'm not going to say Becca Price has bipolar 2. I'm going to say Becca Price has been diagnosed with bipolar 2, was on high doses of Geodon and Cymbalta, now on 40 milligrams of Geodon and off the Cymbalta entirely. Any advice for dealing with the withdrawals?
So the withdrawals are really important to manage in a safe way. The most important piece of advice I would give you is go super slow and pay attention to your brain and body and what they're telling you. Your brain and body are going to tell you if you're going too fast off them or not. And how are you going to know? Because you're going to have symptoms. So your psychiatrist is going to say, well, see, if you're doing any of this on your own, or even if you're doing it with your psychiatrist, a lot of times the psychiatrist will say, see, I told you you need your meds. But if you have symptoms within a few days of lowering the dose of medicine, within a few days, 100% of the time, in my mind, that is withdrawal. That is not you need your meds and you better stay on your meds for the rest of your life. That is medication withdrawal.
Because in most cases, we're trained as prescribers that it's going to take weeks or months for this mental health medication to really kick in and have any noticeable effect. But yet when somebody decreases or stops a med and they have a side effect just the next day, somehow magically that means that they need their medicine, not that that's a withdrawal side effect.
Exactly.
Wow.
And I would argue it is 100% a withdrawal side effect. The really good news is that as long as you understand that and recognize that, there's a really easy treatment. Go back up on the dose. And
Absolutely.
just
Magically it goes away.
And that doesn't mean that you're giving in. That doesn't mean that you're giving up on trying to get off your meds. It means you are being responsible and smart and wise, and you are paying attention to what your brain and body are telling you. And what your brain and body were telling you is you just went off way too fast. That was way too much for me. And now I'm having symptoms, and you don't want to have symptoms. And please don't just like I've seen a lot of times people are like, well, I'll tough it out. Please don't tough it out, because it can get worse and it can spiral out of control. And then within a few days, you could be suicidal or something worse. And then your life is in danger, and you're not thinking right anymore because you're in withdrawal. And it can seem like a good idea to kill yourself when it's really the worst idea in the world to be doing that. So if you really have significant withdrawal symptoms, just go back up on the dose, wait a little longer before you try to decrease it again, and or decrease it by a much smaller amount the next time. So if you went down by 30 milligrams, next time, don't do that. Next time, go down by 15 milligrams. Or if you can get it into 10 milligram or 5 milligram increments, try to cut it up into tiny amounts so that you can just decrease it just a little bit at a time. I have some patients who, they go to compound pharmacies and they get 1 like they're on 30 milligrams of some pill. And they got 1 milligram pills so that they can go down by 1 milligram every week or something. And that is a really safe way to do it. It's painfully slow and it's expensive sometimes, because sometimes your insurance doesn't cover the compound pharmacy costs, but slow and just important. Pay attention to what your brain and body are telling you, because they will tell you whether you're doing it right or not.
Totally agree. And so many people who are currently taking one or more mental health medications, you got to understand this is not a sprint. This is a marathon. And especially when it comes to the benzodiazepines, I've had feedback from hundreds of people who did the strategy you just talked about. Go to a compounding pharmacy, because if you're taking 2 milligrams of Xanax 3 times a day, and you've been doing that for more than just a few weeks, you're 100% addicted to Xanax. Your doctor has gotten you as addicted to Xanax. Same holds for Klonopin, Valium, and all the other benzodiazepines. And for some people, the withdrawal side effects are so egregious that they'll go to a compounding pharmacy, and with a compounding pharmacy, they can lower it literally 10%, and you can go down 10% or 5% every 2 weeks or once a month or whatever. I know some people, it's taken them over a year, Dr. Chris Palmer, to get off their psychiatric medications. Fasting for My Health says, so let's frame this like this, Doc. You've got a new patient who comes to see you in your practice, and with the chief complaint of depression, and you talk to them, and they meet all the criteria for major depressive disorder in the DSM. What would your initial, and obviously, guys, this is not medical advice, but what would your initial advice be to that hypothetical patient who the average psychiatrist would be like, oh, you've got major depression. Obviously, here's some Zoloft or Xanax or whatever the latest thing is.
So my, working theory now is I'm first going to figure out, are they having a reaction to adversity, or do they have a metabolic brain disorder? So the first thing I'm going to ask them is, why are you depressed? Now, if they're quick with, well, I just broke up with my girlfriend of 10 years last week, and I'm heartbroken, and she dumped me, and she was loved my life, and I just can't picture myself getting any better or finding anyone else. I'm going to say, okay, this person is having normal depression. It is a reaction to adversity. They don't have a brain disorder, at least not yet. but they need help. They need to talk to somebody. They need to figure out some strategies. And sometimes those strategies are going to just be talking and helping that person get perspective, encouraging that person to reach out to family, friends, other people in the community. If they're part of a faith community, reach out to them. Like wherever they've got community, reach out, tell people this, I'm in crisis. I'm sorry, I'm not stronger. Maybe you all think I should be strong, but I'm just not. And I am having a really horrible time and I got dumped. Now, I'm also going to focus on self-care with that person. And that means they need to be getting good sleep. Lay off the heavy alcohol and drug use. It's understandable you might be drinking a lot more because you got dumped by the love of your life, but that's a downward spiral pretty quick. So let's not go there. I'm going to focus on diet. Are you sitting around on the couch just eating tons of junk food, stuff in your face? That's not going to help you feel better. Are you exercising? Have you ever exercised? Did you get out of exercise because you just feel like so crappy? Let's see if we can get you exercising again. So that's all reaction to adversity. If somebody says, doc, I have no idea why I'm so depressed. It just, it's been going on for months. There's no good reason. I look at my life and it's actually pretty good. I got the greatest girlfriend. I got the greatest job. I got plenty of money in the bank. I don't know what's wrong with me. I am so miserable. I'm even thinking about death and maybe even just killing myself. But I don't know why. I don't know why I'm so miserable. Then I'm going to say, this person's got a brain disorder. And I am going to think this person has a metabolic brain disorder. And I'm going to be looking for causes of that. Now, as a physician, I'm probably going to run some tests. I'm going to look at thyroid hormone levels, maybe be looking for vitamin deficiencies like B12 deficiency or some other things. I might be checking, just inflammatory markers to make sure this person doesn't have new onset cancer or something like that, because that can happen. Sometimes the first sign of cancer is that people are like, I'm depressed. I don't know why. And so as a physician, I don't want to be missing some of those medical diagnoses that, this might be the first sign of something that could even be life-threatening. So let's identify that, figure that out. But if all that comes back normal, then I'm going to think, okay, now you got a metabolic brain disorder. I'm going to be looking for signs of insulin resistance in this person. I'm going to be, maybe even that's part of the lab work. I'm going to be checking, or I'm going to be looking, does this person have a big gut, big belly? Do they have high glucose levels, anything like that? If they've got insulin resistance, that's almost certain playing a role. And there's a really easy treatment for that. And you all here at Dr. Barry's, YouTube channel already know the treatment for that, a good diet. So, let's put them on a proper human diet, and that will probably take care of that insulin resistance.
Absolutely. Now, how many of you guys are watching this right now and your brain just exploded when Dr. Chris Palmer, a psychiatrist, said, well, the first thing I would do is order some lab work. How many of you guys have been seeing a psychologist or a psychiatrist for years, and they've never checked any blood work on you whatsoever? Because Dr. Palmer's exactly right. There's a long list of medical conditions that mimic mental illness to the point where you'd have to be a psychic, not a psychiatrist, but a psychic, if that were real, to actually know, does this person have depression, or do they have undiagnosed hypothyroidism? Does this person have depression, or do they have a tumor? There's a long list. And so last time we did this together, Dr. Palmer, we talked about mental health disorders. The diagnosis of them really need to be a diagnosis of exclusion.
Yes.
And if your mental health provider is not ordering lab work, then they're not excluding anything. They're just assuming that your symptoms are due to a mental health disorder, which in my opinion is bad medical practice, if not malpractice. Chaz says, fluoxetine, aka Prozac, comes in liquid form. Oh, this is a great hack. I hadn't thought of this. Get it in liquid form, and that makes it, then the patient themselves can literally taper it down as slowly as they need to. So don't most mental health medications come in a liquid formulation, Doc? And can people use this hack from Chaz?
It's a great hack and it's a great suggestion. And Prozac does come in liquid. Some of the other ones do, but a lot of them sadly don't. I've had patients like with Effexor, for instance, who Effexor comes in a capsule and then there are all these little beads inside of it. I've had patients who have to take the capsule apart and just take like 1 or 2 beads out every they take 1 or 2 beads out in week 1, and then in week 2 they take 4 or 5 beads out, and then they just keep taking more beads out in order to taper off in a really slow, methodical way. But there are lots of ways to do it. Sometimes I have patients just use a sharp knife or even a razor blade to just shave just a tiny bit off of the pill. If it's just a pill, just, don't even cut it in half or don't even cut it into quarters. Like just shave just a tiny, tiny bit off and then keep shaving. Like every few days, shave just a little bit more. That has a little bit of placebo in it too, because people are like, well, I'm not shaving that much, so this can't make that big of a difference.
Right.
But they can a lot of times then get down to like half a pill. And then I'm like, okay, let's hold steady here. Let's give your body like a good 3 weeks or something to get used to this half a pill. And then we'll start shaving some more off and we'll get you off this medicine one way or another.
Yes. Fasting for Health says, well, what lab work should they even, since they're not ordering it, they obviously don't know what to order. So maybe if I had a list and I took that list to my healthcare provider. So I've got a book called Common Sense Labs, and I don't want to waste Dr. Palmer's time talking about all the labs, but there's a link down in the show notes, Common Sense Labs book, that has all of the lab testing you need to get your metabolic health completely checked. And so any of you guys, if you've been diagnosed with depression, anxiety, OCD, any personality disorder, even schizophrenia, you absolutely need to have your metabolic health labs checked by some doctor. But I think it should probably be by the doctor who assumed you've got a mental health disorder when they didn't even check your metabolic health at all. But there's a link down in the show notes if any of you guys want to get a list of the medicines that you can take to your psychiatrist or your medical doctor and say, hey, dummy, why did you just assume that I had depression? How do you know I don't have hypothyroidism? How do you know I don't have undiagnosed prediabetes or super high insulin? How do you know? So I think that it would be a great tool for you to open a discussion with your doctor. Let's see if I can find another question here. So I'm getting a lot of comments. I have a lot of followers who literally a carnivore diet, which is a diet that consists of exclusively healthy animal fat and healthy animal protein. Their mental health, it's almost like switching on a light bulb. And for some people, it feels almost miraculous how quickly their mental health condition improves when they're eating a carnivore diet. Are you a proponent of carnivore as an option, or does it make you nervous? Have you heard this similar kind of feedback about a diet full of only animal fat and animal protein?
So I know lots of people who do the carnivore diet and swear by it. And so I am a big fan of being open-minded to whatever works. And as a psychiatrist, a lot of people get all worked up about, carnivore diet, that's going to give everybody a heart attack. Well, you know what? As a psychiatrist, this is a really easy decision for me because the alternative is I'm going to put you on 4 pills that we know with certainty are going to make you gain massive amounts of weight and make you diabetic and make you have premature cardiovascular disease and make you die an early death. So compared to that, I'm really good with a carnivore diet. Anybody who says, I'm worried about all that saturated fat, I'm like, well, I'd be worried more about the pills that I would have to prescribe in place of the carnivore diet. So there is no doubt. I'm not a proponent of there is one and only one diet for all human beings. I'm just not. And if carnivore diet is working for somebody and really working well, 100%, I'm all for it. I might want them to routinely or occasionally check some of those labs that you mentioned. Just stay on. Let's at least just see what's going on. And if there are any labs way out of whack, or if other metabolic health markers are out of whack. I want your blood pressure at a really good level. If your blood pressure is really high, that's a warning sign to me that there's something going on with your metabolic health. And it may have nothing to do with diet. It might be, oh, I didn't know you smoked 2 packs of cigarettes a day. Well, now we got to talk about that. But I'm going to pay attention to some of the metabolic biomarkers, because if they're out of whack, then I do want to at least understand, what is this person really eating? What else is going on? How can we reduce some of these biomarkers that we think probably do play a role in health? But yeah, no, I know people who've tried the ketogenic diet. It kind of sort of helped them. And then they went to carnivore, and it made all the difference in the world. But at the same token, I know other people who've done the keto diet, and that was the life-saving diet for them. They didn't need carnivore. They didn't want to try carnivore. And I'm all for that too. So
Absolutely.
Whatever works.
That's why I think the proper human diet, there's a spectrum of carbohydrate tolerance. Some people need as close to 0 carb as they can get. Some people can handle 20 total grams or even 50 total grams of carbs a day. Joe has a concerning comment here. He says modern psych meds do not have addictive properties. Stay away from the old stuff like benzos, sleep sedatives, meth pills for ADHD, etc. Would you agree, since you are a mental health expert who is very keenly aware of the modern medications, would you agree with Joe's statement, or would you have something to add?
I think sometimes it gets into the definition of what do we call addiction. So even SSRIs, people like Zoloft or Paxil, people develop tolerance to those, and they could have horrible withdrawal symptoms. Is that addiction? Most people would probably say no, because people aren't going out trying to use extra Zoloft or extra Prozac. But now they're having withdrawal symptoms, and that means they can't live without it. And if they try to live without it, they're really in distress, and they're having a lot of physical and mental withdrawal symptoms. So is that addiction? Some people would say maybe.
Yeah.
But some of the other modern medicines like Adderall and Ritalin, there's zero doubt in my mind those are addictive. I see people in treatment programs who are hooked on those, and those are ADHD meds. And there's no doubt in my mind
Absolutely.
that people can get addicted to those. You go to a college campus right now, and Adderall is rampantly sold. It is sold. Sold. People usually aren't selling non-addictive things.
Right. I can't tell you how many young patients that their parents would bring them to the office during their first semester of college and say, I think Joey has attention deficit disorder. And they've already Googled the questionnaire, and they already know the answers. And so Joey's got a 100% positive screening test for ADHD. And obviously I knew what was going on. The parents knew. They just wanted Joey to have some Adderall so that he could focus better, not realizing the danger of basically legal methamphetamine for little Joey. And then also his roommate's going to be stealing his Adderall. Joey needs some money. Joey's going to be selling his Adderall. Stacy Webster says, happy birthday, Dr. Berry. Today is my birthday. And this is how I choose to spend it with my good friend, Chris Palmer, 100%.
I am honored. Happy birthday.
If you guys want to wish me a happy birthday,
we're all going to have to sing happy birthday to Dr. Berry.
Yes, I think Chris Palmer should sing happy birthday, but you guys can share this video as a birthday present to me. Listen to this comment. Sarah Rose says, I've been on Cymbalta since 2007. My psychiatrist doesn't want me coming off, but he told me if I was going to stop, just to stop it immediately. I feel like he's setting me up for failure. What do you think about Sarah's feelings about this?
I think your psychiatrist is setting you up for failure, that he's trying to teach you a lesson that he knows better, and that and that he knows you're going to have withdrawal symptoms. He knows you're going to feel like shit. Your depression's going to come right back. You're going to have anxiety or panic attacks. And that if he gets you to stop at cold turkey, then that'll prove his point. That, see, I told you needed that medicine. If that really happened, I have to assume it really happened because you typed it in. That is like heartbreaking.
What is that, Dr. Palmer? I mean, obviously
psychiatrist would do that to you.
Obviously, this psychiatrist, if they have two neurons in their cranium, they know that she's going to have immediate withdrawal symptoms from that, and a rebound depression symptoms that could leave her suicidal. Yet her doctor has just said, "Oh yeah, if you want to stop it, just stop it cold turkey. I'm not going to help you wean that down." What the hell is that? Well, is that malpractice? What is that? Is that felony? I don't know. I mean, that obviously you can tell that pisses me off.
The control thing pisses me off too. The fact that, well, I'm not going to listen to you. You want something? You want to get off of medicine? Well, tough shit. You're going to have to do what I say. It's my way or the highway. And like, I just don't like that approach ever. Like, I have patients all the time, and sometimes I'll tell them, I really don't think you should come off this medicine. Not yet, sure. Not right now. Like maybe another day, maybe next year, maybe next month, maybe whatever. But right now, I'm really, really worried. But if they keep on me, like, well, I'm coming off, then I'm like, let's come up with a plan. I want you to be safe. You do not stop at cold turkey. You're going to end up in the hospital, and then they're just going to load you up with more meds. So even in that case where I feel strongly that maybe somebody should be on a medicine and they feel strongly that they don't want to be on it, I work with my patients. I'm like, well, no, this is your body. It's your brain. It's your life. Like if you're telling me you really want something, then it's on me to like help you achieve that. And let's see if we can do it. Let's see if we can slowly wean you off. Let's see if, and it's my job to warn you. Like I said, if I'm worried about it or if I don't think it's going to work out, it's my job to at least share my opinion, but it's not my job to control you. And it's certainly not my job to manipulate you or tell you to do something dangerous and reckless and knowing you're going to get in trouble. I agree with you. Like if somebody took that advice and went out and became suicidal or actually killed themselves, that sets that provider up for a major malpractice.
What do you want to bet that provider didn't document that advice in the permanent medical record? Yeah, 100%. They just said that verbally, but then, they documented the advised patient to continue medication. So if the patient did take that verbal advice, the doctor's protected because it says right there in the medical record, I told her to continue her medication, and she wasn't following medical advice. Keith's got a worrisome comment. 30-year-old son diagnosed 8 years ago with bipolar 1, has been manic for the last month, hospitalized for most of it, now coming down, multiple hospitalizations. Help. What would you, if you were having coffee at a restaurant and Keith told you this story, so obviously this is not medical advice, you were just giving him your opinion, what would be the first 3 steps or the first steps you would say, hey, Keith, here's how you can help your son?
So the first thing is I would actually encourage you to learn as much as you can about the brain energy theory. So, and I'm not here to sell a book. I don't give a shit about selling a book. But I do.
He's not trying to sell books. He's trying to change the way mental health is treated.
I do care about your son and getting him better. And that means a paradigm shift because the current paradigm sucks. Your son is going to be in and out of hospitals. I already know, you don't have to tell me, they're doping him up. He's probably on at least 3 different meds, max doses, and he feels like shit. And when he finally comes down from this, he's going to be sleeping more than 12 to 14 hours a day. I can tell you already. He's going to be gaining weight, and he's going to be complaining about these pills make me feel crappy. I'm going to stop them. And then you as the family are going to be like, don't do that, because the last time you stopped them, you were in the hospital and running crazy and all sorts of hell was breaking loose, and don't do that. Just take your pills and behave yourself. And everyone is frustrated and stuck in that situation. That is what's happening to millions of people around the world today. So you and your son are not alone. So I want you to learn the theory first, so you can understand why those pills might decrease his symptoms, but also why those pills might be toxic to him long term. But then I want you to understand what are some of our treatment options. And some of the treatment options might be a major change in diet, something that stimulates the ketosis, whether it's keto or carnivore or something else. Some type of a ketogenic diet can really be a powerful brain treatment, but it needs to be done in the context of no alcohol or drugs, still getting good sleep. And if that works, usually I tell people give that at least 3 months. If that works, then you really got to work with the provider. And that means you got to find a provider who's going to work with you on this. Slowly but surely wean off some of that medicine. And if you can do that in a safe, controlled way, I can tell you, I know dozens of people with long-standing bipolar 1. They have been manic, psychotic, they've been hospitalized, they've been arrested, and they are in remission now. Their illness is in remission. Many of them off medicines, and they are living new lives. They are finishing college, working full time, getting boyfriends, girlfriends. They are new people with a new lease on life, and there is no reason that your son should not be one of those people.
Totally agree. Wonderful answer. Now, Kathy, you might as well get ready for this, Dr. Palmer, because this is going to happen. In my book, Lies, I talk about something I call the echo of the lie, because now you'll hear healthcare providers and psychiatrists on Twitter saying, well, we've known for years that it wasn't about a serotonin deficiency or a neurotransmitter imbalance. Nobody ever said that. It's like, well, first of all, Bubba, yeah, a lot of damn people said that. And secondly, now we've got to contend with people like Kathy. Thanks for the comment, Kathy. But Kathy says, isn't it all about increasing our serotonin or other feel-good hormones? This is the echo of the lie. She's heard this from her doctor and from nurses and from her friend who works at the hospital. We've all heard this lie so many times that you, my friend, get ready for it. You're going to have to repeat 100,000 times the answer to Kathy's question. So go ahead and answer Kathy again and just get ready, because you're going to answer this a bunch of times.
So the answer is no. And in fact, increasing serotonin, again, for some people, it can be helpful. But if you look at the overall treatment, let me just paint an accurate picture. If you believe that all of the pharmaceutical studies have actually been published and we have gotten accurate information, and I know a lot of people don't. A lot of people think that, that ain't true. But even if you believe that, if you go in with your first episode of depression and get treatment with one of the gold standard treatments, the statistics that everybody talks about, 70% chance that you will be a responder, which means some of your symptoms will go down a little, but only 30% chance that you'll get remission. What that really means, that 30% is key. What that really means is that if you go in and get gold standard treatment for plain old depression from one of the best psychiatrists in the world, there's a 70% chance that you're still going to be depressed 6 months later. His treatments or her treatments aren't going to work.
Yep.
Only 30% chance that your depression is actually going to go away. 70% chance your depression is not going away. That means the treatment just does not work. And so instead of thinking about depression as a serotonin deficiency, I want you to start thinking about it as a brain energy deficiency. Your brain needs metabolic health, which means energy for your brain. And you can restore your brain energy not by taking serotonin pills, but you can restore your brain energy by a lot of common sense things that people like Dr. Barry have been talking about for ages. Let's get a proper diet. Let's make sure you're sleeping. Let's reduce your stress if we can. Maybe throw some exercise in there. Maybe lay off the heavy alcohol or drug use. And we're going to put all that together. And although everybody's like, well, but we already know all that. Well, everybody knows it, but they're not doing it.
Yep. And so how many of you guys have never heard the statistic that Dr. Palmer just said, that there's a 70% chance this pill's not going to help you a damn bit? Did your mental health provider tell you that? Did your psychiatrist tell you that? Did your family doctor say, oh, I think you're depressed, I'm going to start you on some Zoloft or some Effexor? Did they say, but there's a 70% chance it's not going to help you a damn bit, but I'm still going to prescribe it for you? Or did they lead you to believe this is probably going to help? But they didn't. They left out that 70% statistic. Dave says placebo controlled 30% is not worth the time and effort and issues. 100% agree with that. 100%. Neil's never heard that stat, and he's very aware. He's watching YouTube videos about physical and mental health all the time. He's never heard that before. Why are we not here? Why don't they say that in the Zoloft commercials? There's a 70% chance this won't help you a damn bit. Wonder why.
Well, and so I would put it slightly differently, and that's assuming we trust all the stuff they're saying. So the statistic you're going to hear is there's a 70% chance that you'll get at least some tiny improvement in some of the symptoms. So that means instead of being severely depressed, maybe you're just moderately depressed. So 70% chance that you'll get a slight improvement in symptoms. Kind of like if you take a Tylenol, there's a 70% chance it'll reduce your pain a little.
Yeah.
But will it make your pain go completely away? Tylenol probably is better at treating pain than SSRIs are, or antidepressants are at treating depression. Because the statistic I'm saying is 70% chance if you take an antidepressant and if you trust all the gold standard studies. And again, the negative studies don't get published, so we really should not trust all of these statistics. But what they say is that 70% chance you're still going to have depression. One study that followed people for 12 years, 90% kept getting depression over and over again over that.
Even in the face of psychiatric prescription medications.
They were all taking their pills. Only 10% of them did the depression go away and stay away.
That's not a very good track record.
Only 10%. It's a horrible track record. And yet mental health professionals will say, we got evidence-based treatment. Everybody get their treatments. Well, trust me, I don't say this lightly. And I don't say it because I'm not really necessarily interested in fighting a huge battle with pharmaceutical companies or with psychiatrists or neuroscientists. That's not my goal. My goal isn't to just fight people or be a naysayer. My goal is to fight for people who are suffering, whose lives are devastated by mental illness. And it is unfair to tell them that our treatments work when in fact they do not. It is unfair to them to be offering them shitty treatments that don't work. It is unfair. It's unfair that bipolar guy we just heard about who's stuck in a hospital getting drugged up and is going to feel like shit when he gets out. It is unfair to him and his family that that's all they're getting. They could have been implementing more effective brain energy treatments for that guy while he was in the hospital, but they didn't. And I want to get people help. I want to get people real, honest information. That means I'm going to have to fight a lot of people, and that's okay.
That sounds like the words of a good doctor to me. Christy wants to know, what do you think about SSRIs for PMDD? What's the research really show, and what's been your personal experience?
The research shows that they kind of sort of help. They don't help as much as with major depression, though. So we're talking less than 30% remission rate. At the end of the day, I am a big fan of whatever works, though. So if you have PMDD and you're already taking an SSRI and it is really working for you, keep taking it. Like if you're not having side effects, if you're doing well on it, I'm all for it. The reality is when we look at real people with these disorders, they're like, but it's not helping, or I don't know if it's helping. It's been months and I don't know. I'm still having all these symptoms and now I'm having new side effects and now I can't sleep well. And now I'm gaining weight. And is it related to this pill? I don't know. I don't have any energy. I'm tired all the time. Is it related to this pill? And I would say, if you're in one of those positions, then maybe you need to be looking at some lifestyle treatment strategies to restore your metabolism, diet, exercise, all the other ones, and maybe try to get off that pill. Again, you can't stop it cold turkey, because if you stop it cold, even when it's not doing anything, that's the funny thing about these pills. So I've had patients tell me, but the pill never did anything good, so I can just stop it cold turkey. I'm like, whoa, no, you can't. Now you're hooked. Sorry.
Yep.
It's like,
and when Dr. Palmer says hooked, he doesn't mean necessarily that you're addicted, that you're wanting to abuse the drug. When he says hooked, especially when it comes to psychiatric medications, he means that if you stop that medicine abruptly, you're going to have potentially ghastly side effects, just crazy, psychotic side effects. Yes. From stopping that medicine prematurely. And I think that's one place where psychiatrists do a great disservice to their patients. Before they start a psychiatric medication, I think there should be a very clear conversation that when you do get better, because we should all be positive like that and phrase things that way, it's going to be hell for you to wean down and get off this medication. The side effects are awful. The withdrawal effects are awful. So I'm going to have to help you. It might take me months or years to wean you down off this medication, but I think you need it. So I'm going to go ahead and start it. How often do psychiatrists forget that part of the conversation?
Always. They always forget that part of the conversation. But I completely agree. I think that should be part of informed consent to a treatment, is that we can start this pill. There's only a 30% chance that it'll make your depression go all the way away. There's only about a 10% chance that it'll make your depression stay away over 12 years. And if the day comes when we decide to get you off this medicine, either because the medicine didn't work or you're having side effects, or maybe, 5 years from now, you're doing great and you just want to see if you can get off, we're going to have to taper you off slowly. You can't just stop this cold turkey. If you go on vacation and you forget your pills, you could get seriously ill if you try to go without your pills. So you can't do that. I would have to call in a new prescription for you in whatever state you're in, and we'd have to try to get you a prescription that way. I think that is what's called informed consent. And unfortunately, that almost never happens.
So you're saying that it is more typical than not for a psychiatrist who's about to prescribe a psychiatric medication to not mention any of the things that you just said, any of the facts that you just relayed to this audience of over 1,000 people, that it's more typical to not mention, to not have that conversation than it is to have that very important conversation.
Yeah. No, wow. Almost no psychiatrists have that conversation.
Wow.
There are some states, like the state of California, I know sometimes requires that. There was one time, and I don't know if it's still the case. It might be. I don't live in California. I live in Massachusetts. But at one point, I actually went to practice in California, and the California government kind of knew that psychiatrists were sleazy. So they actually said, whenever a psychiatrist wants to prescribe a psychiatric pill, they have to get written informed consent from the patient with all these things, all the things I'm talking about. They have to get a written signed consent. If a family doc wants to prescribe that same pill, they're okay. They don't need to get written conformed consent. We just don't trust the psychiatrists.
Is that the definition of state sanctioned insanity? It sounds to me like it is, because Dr. Palmer knows this, but you guys may not know this. You may assume that the majority of psychiatric medications get prescribed by psychiatrists. Not true whatsoever. The vast majority of medications for anxiety, depression, OCD, even more really mental illnesses that should be only in the scope of psychiatry, like the personality disorders and schizophrenia and schizoid. Their first psychiatric medication, what percentage of the time, doc, it comes from their family doctor or their OBGYN or their internal medicine doctor or their pediatrician. That's who started them on this medication. And the average primary care doctor has no freaking clue about the withdrawal side effects that you just talked about. Do you know the percentage, or roughly guesstimate what percentage of new prescriptions for psychiatric medications are prescribed by primary health care?
I actually don't know what the current statistic is. It's changed a lot over the last, especially since the pandemic, because the pandemic has just wreaked havoc on our population and just about everybody. I talked to a pharmacist who's like, everybody coming into the pharmacy nowadays is getting antidepressants, anti-anxiety pills, whatever. What I can say is it's definitely much, much more than 50%. So way more than 50% of the people who get an antidepressant or an anti-anxiety pill are getting it from a non-mental health provider. So that usually means their primary care doc, an internist or family doc or OBGYN or pediatrician. They're getting it from somebody. And trying to find a mental health professional is next to impossible. You almost can never use insurance nowadays to find a psychiatrist to prescribe.
That's a huge problem. Huge problem.
You got to pay out of pocket. And even if you've got the money to pay out of pocket, it can be next to impossible still to find somebody who's taken new patients. We are in crisis. The world and the United States, we are in a mental health crisis. And a lot of people are like, where the hell's all this coming from? Why is everybody melting down? Why is everybody getting diagnosed with all these disorders? And what I'm saying is that mental disorders are metabolic disorders. It is not a coincidence that at the same time we have skyrocketing rates of obesity and diabetes and prediabetes, that we have skyrocketing rates of mental illness. They are directly linked to each other.
Absolutely. Absolutely. And so when you have the combination of just a shitty standard American diet, the standard Western diet, which is causing epidemics of metabolic disease, whether it's hypertension, prediabetes, type 2 diabetes, fatty liver, metabolic syndrome, obesity. And then you take these people who are already metabolically sick, which directly affects the brain, and then you put them in a lockdown situation, income lowered, freedom lowered. You can't even interact with other people except virtually. What would you expect to happen if not an epidemic of mental illness? That's exactly what's going to happen, because the brain is already to some degree crippled by the shitty diet that they've been told is healthy. And then you put them in a super stressful situation. Of course, you're going to have a mental health epidemic. Paula says that her daughter's dermatologist prescribed her Xanax. And she said, no, thanks. Well, what do you think about specialties completely unrelated to psychiatry, trying to start somebody on Xanax?
Good move. A dermatologist prescribing Xanax, it reminds me of a malpractice case that I actually was asked to testify in, where there was a non-mental health doctor prescribing Xanax actually for a patient, got her hooked on it. and then was having a sexual relationship with that patient.
Yep.
And used the Xanax to get sex when he wanted it. Yep. And told her, I'm not going to give you your Xanax unless you come over. We got to have a date again or whatever. And that went on for a few years. And, you know, she was hooked. He was clearly a drug dealer. And it was just a nightmare situation. But a dermatologist prescribing Xanax, what the hell are you doing?
Yeah, hideous. And so there's so many motivations for doctors that people don't understand. They just trust their doctor that he's going to do what's best for me. She's going to make the best decision. They forget that doctors are just dudes and chicks, just like you and me. They're just dudes and chicks. They have their own motivation. They have their own goals. And so your doctor, the dermatologist's goal may not have been to have sex with your daughter, but it's weird. That's a highly weird scenario. Weird. But weird. That so doctors really only have two ways they can help you in their mind currently. I can give you a diagnosis, which feels like an answer. This is why you have what you have. And then I can also give you these magic beans. I'm going to write you a prescription. Yeah. And that's the only tool I know how to use. Right. And so then they feel justified. I did a good job today. I helped some people as far as they know. And so, but they're literally, this dermatologist has no business prescribing Xanax. I can't even think of like if somebody had severe psoriasis covering 95% of their body, and that was leading to mental illness, which it definitely could lead to symptoms of mental illness, the dermatologist still should not be giving you Xanax. That dermatologist should be referring you stat to a mental health care professional so they could figure out, do you need some temporary Xanax at a low dose, or do you need something else, or do you need something? But never should you be getting controlled habit-forming medications from a specialist that is completely not related in any way. And I'm a family doctor, Chris, but I think that applies to family medicine as well. And I'll be one of the first family doctors to say, any family doctor that's routinely starting a patient on Xanax, routinely starting a patient on Klonopin or Valium or even Ambien,
oh yeah,
that's sketchy. That is weird. Either your head is too big for your shoulders, or your head is not big and not filled enough with knowledge. You should not be doing that. So any of you guys, if you've had a habit-forming medication, any kind of psychiatric habit, so whether it's ADHD, whether it's anxiety, anything that's habit-forming that your family doctor just prescribed that for you and they refill it for you every month, and you've never been referred to a psychiatrist, that's weird as hell. That's probably not up to standard of care, and you should probably immediately start to question that and ask your primary care physician, could you refer me to a psychiatrist, please? What do you think about that, Doc?
Yeah, I completely agree.
It happens so commonly. I guarantee you, people are sitting there going, oh, that's exactly what happened to me. My doc never checked labs. My doc never sent me to psychiatry. He just started me on Geodon, or Klonopin, or some Zyprexa, or some crazy strong psychiatric med. Never checked any labs. Never referred me to psychiatry. This happens every day. You guys tell me in the comments if this happened to you in the past. The Veterans Administration. Let's talk about that, Chris Palmer.
That is even more heartbreaking and tragic, because these are men and women who have put their life on the line for all of us and for our country, and they come back, and sometimes they're appropriately struggling because of the horrors that they experienced when they were at war. And
yes,
and when we look at like how we're just failing to serve them fully and effectively, it's tragic and heartbreaking. I mean, the suicide rates among veterans are much, much higher. The addiction rates among veterans are much, much higher. Because again, when people are tormented by symptoms, they're much more likely to turn to drugs and alcohol to try to numb that pain or numb those symptoms. Veterans are more likely to be homeless. I mean, it's again, it's heartbreaking. And
Absolutely.
sometimes the VA can do a good job, and I'm not here to totally bash the VA.
I agree.
Some VAs do a good job. I'm not even going to minimize it with decent. They do a good job with mental health. Some of them do, but not all of them do. And, you know, a lot of them have long wait lists, and a lot of them are just pill factories. And you know, so, yeah, we need an overhaul in all of mental health, including at the VA.
I totally agree. And I've talked to many docs in the VA system. And during my training, I did several months at the VA Medical Center in Memphis, Tennessee. And I was daily flabbergasted at how the veterans were treated. And in my subsequent study, I've come to learn that veterans basically have been getting the shaft since the very first war, not in America, but in the history of humanity. Veterans always get the shaft every single time by every single society on the face of the earth. It's probably less bad in America and the UK than it is in other countries, but they still get the shaft, and it breaks my heart. But I don't know how to fix it. Judith said her eye doctor prescribed Celexa and Trazodone. 100% weird and inappropriate. What the hell? I can't think of an ophthalmological diagnosis where it would be appropriate.
I can't either.
And I think part of the problem, and tell me what you think about this, I think a big part of the problem is that SSRIs and other mental health care prescriptions have become so ubiquitous, so overly advertised, and they've just become part of life that I don't think the average ophthalmologist or dermatologist, I don't think they have any healthy respect whatsoever for the psychiatric medications. They don't know what they don't know, but it's been so normalized that they're like, well, shit, everybody's on Celexa. It's not a big deal. What do you think about the normalization of everybody being on Zoloft or Celexa, Trazodone, etc.?
I was just going to say that. I was going to say, you know, I can create a story, at least in my mind, to try to understand and defend this eye doctor. So this eye doctor probably buys into the rah-rah from the mental health field of our treatments work. The reason we got all this depression and anxiety and misery in the world is because people aren't getting treatment. If we just got them effective treatment, they would all be better. Well, again, let me tell you, that ain't true. It just ain't true. Even if we get them better treatment, it don't work for the majority of people. But this eye doctor probably believes that. And so she or he sees somebody who's suffering and like, oh, you got bad anxiety. I can write you a pill. I can write you a prescription, and that'll fix you up. And here,
Yeah.
you take this.
Yeah, it's so easy. Even an ophthalmologist can do it.
And I'm doing God's work. I am doing God's work by stamping out mental illness, and I'm relieving this person's suffering. Now, on paper, that all sounds good, doesn't it? It sounds like a really nice world and a good-hearted doctor who had really good intentions. But the reality is, again, our treatments just don't work. They don't. And I'm not saying that to be mean. I'm not saying that to be bitter. I'm saying that to give honest, accurate information to the people, because you deserve the truth. And that is the truth.
Absolutely, 100% agree.
And this doctor should know that. And then this doctor probably also didn't warn this person, oh, if you want to come off this Cymbalta someday, well, good luck with that. That's a shit show. Yeah,
what do you think the odds are that this ophthalmologist gave them true informed consent about this psychiatric medication?
No.
Yeah, exactly. So, Dr. Chris Palmer, thank you so much for doing this. Dr. Chris Palmer is getting the truth out there that a large percentage of mental illness is metabolic illness, or at least tightly related to it. His book is called Brain Energy. There's a link in the show notes. There is an Audible for those of you with ADHD like me. And let me just say quickly, and I want to get your feedback. I've had a lot of questions in the comments about ADHD. So I have ADHD. I've had it since I was diagnosed in first grade. That was a long damn time ago. And back then, they just thought I was unruly, rambunctious, just that kid that's never going to pay attention. But in the first year or two of my medical practice, I actually went to a mental health care provider, got the formal diagnosis, and I tried Adderall for a few months. And it did help, no doubt. But I was like, I am busy. I do not have time to go every month for a refill. Also, I don't want to be taking this because I did some research, as any good patient should do. And I found out this is basically legal meth is what this is.
It is.
And so I just got off it. And so when I went from paleo, which was still super high carb, all my metabolic numbers were shit, right? When I switched to a true ketogenic diet, which is lots of fatty meat, eggs with the yolk, some veg, a few nuts, a few berries, my ADHD symptoms got at least 60, 70% less severe. I still had ADHD, make no mistake. Ask Nisha, she'll tell you. But it got less severe. And then when I converted to a very high-fat carnivore diet, I still have ADHD. But the high-fat carnivore diet plus the way I arrange my life, and so certain other strategies as well as that diet, my ADHD symptoms are so less severe now that even if I could get a year's worth of refills for Adderall, and even if it weren't habit forming and basically legal meth, I still wouldn't take it. Have you seen that in your ADHD patients, that when they cut the carbs drastically and improve their metabolic health, that their ADHD symptoms get much less severe?
Absolutely. So I see that time and again. It's and it's really interesting the way it happens, because most people don't recognize it at first. Usually they notice the mood change or the sleep change. So they're like, wow, I've got a lot of energy and I'm feeling great. This is a good diet for after they get through the hangry part of the diet of the first week or so. But once they get through it, they usually notice the mood and everything else. And it's usually like several weeks or a month or two later that they're like, wow, now that I think about it, I'm getting a shitload of stuff done that I could never get done before. Like I'm on fire. Like I'm just banging stuff out. And how'd that happen? What's gotten into me? Like what's going on here? And it happens all the time.
Yeah. Chris Palmer, thank you so much. Keep doing the good work that you're doing, not trying to fight with the current authorities and regulatory bodies, but trying to reach out to just normal people and say, hey, there's another way. There's probably a better answer for you. Mental illness is probably, at least to some degree, metabolic illness in your case. Let's fix your metabolism and see what that does to your mental health. And I'm going to keep an eye out for dermatologists and ophthalmologists who are prescribing psychiatric meds. And I'm going to keep calling them out for the assholes or dumbasses that they are, because it's one or the other. There is no other alternative. And I'm happy to have you back on the channel anytime. I think your message and this mission is one of the most important things that I've ever had to honor to be a part of. So thank you very much for what you're doing, and please don't ever stop.
Well, thank you, Dr. Barry, and happy birthday to you.
Thank you very much, brother.
For that.
Thank you. I'll see you next time.
All right.
Bye-bye.
Bye-bye.